Hello and welcome to my YouTube channel. Today I'll just be running through a number of causes of headaches. We do experience headaches from time to time, and most times they're just benign. In other words, nothing significant, but other times may require more elaborate investigations to determine what the cause of the headache is. And so in terms of causes of headache, number one, tension headache. This is the type of headache most of us have experienced at one time or the other, and typically would affect, say, the entire head, described like a tight band around the head, and a number of times from maybe stress after a very stressful day, and simple analgesics would generally take care of that. Now, number two is cluster headache. This one typically affects men and would typically affect one side in and around an eye on one side of the head, and could be very, very intense. In addition to these, you find them having lacrimation, which is flow of tears, and having a stuffy nose, where there's rhinorrhea, which is secretion of mucus from the nose. Number three is migraine. This typically will affect females, and they find it very difficult to stay where there's bright light. So there's increased sensitivity to light, that's photophobia, and also they feel nauseated, and typically will also affect just one side of the head. Number four, viral illnesses. A number of times when we have catarrh, rhinorrhea, we typically will also have headache alongside. And so that's one of the recognized symptoms that comes with flu or catarrh. Five, parasitic infestations. If you had malaria before, you know that one of the things that could occur in the course of having malaria is also having a headache. Number six, poor sleep. If you don't sleep well, there is a very strong likelihood of you waking up the next day with headache or having headache as the day goes on. And so poor sleep is associated with having headaches. Number seven, brain tumors. Unfortunately, one of the reasons why people have headache is when they have brain tumors. And so these patients wake up in the morning, could actually vomit. And so if you have headache that is intractable, not resolved by simple analgesics, please see a doctor to have a proper evaluation. Number eight, infections such as patients having bacterial infections such as meningitis. One of the cardinal features of meningitis is headache. Others are fever, neck stiffness. So if you have headache with fever, neck pain, stiffness, please see a doctor. Number nine is giant cell arteritis. Now, this is a form of vasculitis. Typically will affect people that are above 50. They tend to have very severe headache and could have pain on one side, typically around this area called the temple. And so another name for giant cell arteritis is temporal arteritis. So what this simply means is that there's inflammation of the blood vessel, and so we call it a form of vasculitis, vascular and vasculitis, so inflammation of the blood vessel. And one of the presentations in patients that have giant cell arteritis is headache. They could also have what's called jaw claudication. They could have, when you do an ESR or blood work, you find that the marker for inflammation is also elevated. And unfortunately, this is one of the conditions that could result in blindness if not properly handled. Number 10, stroke. Patients developing stroke, one of the manifestations is a headache. There are different types of stroke, which we're not going to go into in this video, but one of the manifestations of a stroke is a headache. Number 11, glaucoma. Glaucoma simply means raised intraocular pressure or raised pressure within the eye. And so patients developing or that have glaucoma, one of the manifestations could also be headache. Again, this list is not exhaustive, but I hope you've learned something. If you have, then please do subscribe. It takes just a few seconds to do that before you shut down. Thanks and bye.